Welcome, everyone. Thank you so much for joining us today. My name is Amy Sam. I am the Health Education Project Specialist at the Maxwell and Eleanor Blum Patient Family Learning Center at Mass General Hospital. Today's program is a special collaboration between the Blum Center and Mass General Equity and Community Health. Before we get started, just want to go over a few items with you all. Please note that today's session is being recorded for educational purposes. If you're interested in viewing the recording, you may visit the Blum Center website at massgeneral.org/Blum-Center. Please note that everyone is in listen-only mode. Everyone has been muted so that we can hear our guest speakers today. If you have any questions for our guest speakers, you may use the chat feature, which is located at the bottom of your screen. We'll have time for it in the end. Only Blum Center staff, our co-hosts, and guest speakers will see your questions. Please do not share any personal medical questions or information in the chat box. If you have a personal medical question, please ask your doctor. All right, so next I am going to hand it over to Natalie Johnson. She is the Administrative Director for Mass General Equity and Community Health. She's going to share a few words as well as introduce you all to today's guest speakers.
Thank you, Amy, and thank you all for joining us this afternoon for our talk on staying healthy in a pandemic. What can we safely do? So I want to introduce our two co-presenters today, Dr. Claude Alabre and Efrén Flores. Dr. Alabre is a primary care doctor at MGH with a strong interest in medical and patient education. He's currently the medical director for a health education vlog called Your Healthy Java and one of the medical liaisons with the Office of MGH Equity and Community Health. He has been very active in COVID and vaccine education since the beginning of the pandemic and is involved in many efforts to help reduce health disparities in our most vulnerable populations. Dr. Efrén Flores is a radiologist in the thoracic division at MGH, associate chair of MGB Radiology, Equity, Inclusion, and Community Health, and a community health liaison, clinical liaison for the MGH Office of Equity and Community Health. So thank you both for joining us and putting together this presentation this afternoon. And we look forward to hearing what you have to share with us today. And for those joining us today, please feel free to add your questions and your comments into the chat. So thank you. And Dr. Alabre, turn it over to you.
Thank you, Natalie. Hello, everyone. And I am here to share with you some of the updates on COVID where we are right now, and hopefully help everyone understand what we can do safely. This is a little bit complicated because safety is somewhat relative for a lot of people. But the priority today is to really get everyone to understand that you can't give up on your care, on your health while we're going through this pandemic. We really want to get everyone to understand that going to your doctors for your chronic illnesses or your routine care is still the right thing to do and is still safe. So I will start by showing some statistics on where we are, where we used to be in terms of disparities, and where we are headed, and also a little bit about the safety of going to your doctors and doing certain activities. So I'll start with some slides. This, as you all know, is part of our efforts for the Minority Health Month that MGH is working on. So I'm going to start to talk a little bit about the disparities that we are facing in this country, and especially in Massachusetts. Let me share my slides. Okay. So this is something that we all know has been an issue for a long time in our country. And this is actually specifically for Massachusetts. This is from the Boston Public Health Commission's Racial Justice and Health Equity Initiative. We understand that there are a lot of different factors that can affect health outcomes. These are some of them. It's somewhat of a comprehensive list. However, this was before the pandemic. And what we have learned so far with the pandemic is that everything has been amplified. So the factors that have affected health outcomes are taking an even bigger toll on health. And we could go down here with social capital, education, transportation, employment, food access, health behaviors, and so on and so forth. So there has been a lot of work in trying to reduce the disparities in health for minority groups, Blacks and Browns, Hispanics, and everyone else who may be at a disadvantage when it comes to health outcome. And so the second slide I'm going to show you here is what the access has been. And this is again in 2019, before the pandemic started, where things were at that point. And if you look here, we have the different bars representing different racial groups. In orange, we have Black, Hispanic in blue, whites in green, and other in the tan or yellowish color and other. And so this first block here is showing what the utilization of care was in Massachusetts in 2019. And it's fairly close in terms of routine care. So people who are going for their physicals, what we sometimes call annual wellness visits. And the utilization for Blacks, for example, was about 78%, 72% for Hispanics, 77% for Blacks. So not a whole lot of difference here. And I want to show you this because when we go to the next slide, we'll see where there's starting to be a big gap in access and utilization for reasons we don't always understand, but we know a lot of the factors are the things we mentioned before in terms of transportation, food, education, and whatnot. And so moving a little bit on this slide, we see here when we look at utilization of dental care, there starts to be a bigger difference in that, where for Blacks, it's about 64% of people who actually get their routine dental care compared to 76% of whites and 67% of Hispanics. And if we look at the next slide, where the difference is even greater, this is utilization of behavioral health care. So mental health has been an issue forever, and is even a bigger issue now with the amount of stress and difficulties that everyone is facing with the pandemic. We don't have the data for 2020, 2021 yet, or 2022 even, but in 2019, the difference in utilization for mental health was already quite staggering, where for Blacks, it was about 14%, and for Hispanics, 21%, and for whites, about 16%. And so I wanted to bring these up because we do know that since the pandemic, one of the biggest issues we have faced is people's mental well-being. And if we had a difference in utilization before the pandemic, when one can only imagine what it's like now. And we know it is difficult to access care at times. But there are a lot of services that have been put into place to sort of reduce this access issue. And it's not always clear if people are aware of what's available to them or if they have the ability to access this type of care. But I wanted to bring it up to everyone's attention that the difference that we noticed before the pandemic was already significant, and now it's probably even greater. And we don't want anyone to be suffering alone. And part of this talk, as I mentioned in the beginning, is to really try to get people back into care and not let this sort of the safety of the pandemic be a factor to you accessing what is needed. As a primary care physician, I can tell you firsthand that a lot of people had stopped going to the doctors because of fear of catching COVID. I still have a lot of patients who don't come in the way they used to or at all because of fear. And we don't think this is right. We don't think this is actually needed. There's obviously been a lot of measures put into place to make sure that when people come in to see their physicians in the clinic or at the hospital, that they are at least as safe as possible. Nothing is 100%, but we have put in to place measures from masking, distancing, screening when necessary, especially for procedures and whatnot, to really assure the safety of everyone in the hospital or in the clinic. And so access is difficult for a lot of reasons, but we don't want safety to be the reason people are not reaching their doctors and getting the care that they need, both from a mental health standpoint and from routine care. And so with that as well, I wanted to take a step back to see what things were like pre-pandemic when it comes to vaccinations. As we will talk about a little bit later, we believe strongly that vaccination at this point is one of the best ways to deal with this current COVID pandemic. And so I wanted to take a look at what it was like before the pandemic in terms of racial differences for access to vaccines. And here we have this is somewhat of a surrogate. This is vaccination in children in the United States from 2017. Again, slight differences in racial groups, but not a huge difference when you look at it overall, going from race to race. And I think I might have lost the legends here in terms of what the colors represent. If we remember the previous one, the orange was for Blacks and the green was for whites. So there was a little bit of a difference if we want to take those two as an example, from 67% to 72% in vaccination in children. And so that gives us a sense that there was already a slight difference there. And now this may be even greater. And we wanted to look at the vaccination rates for COVID vaccine. And this is not again, telling us what it is now in 2022, but when this was looked at in 2020, there was a much higher.
Dr. Alabre?
Excuse me, just one second. There was a much higher difference in people's hesitancy about the COVID vaccine when we look at different groups. And just to be clear here, I'm sorry, I don't have the colors, the legends here for the colors again, to tell you which groups is which. Sorry about this difficulty here. Again, this won't make as much sense to you without the actual legends, but what I do know is that we did find that there is a much greater hesitancy in Blacks and Hispanics and minority groups when it comes to the COVID vaccine than we saw in whites. And the vaccination rates is still very different in terms of how many people have received their COVID vaccines when we look at different racial groups. Again, as a tool that we believe is probably the most important one to fight this pandemic, we don't want anyone to be missing out and not get their vaccines, because when we look a little bit later at what one can do to stay safe, this is at the very top of that. And in every list, every way you look at it, getting your COVID vaccine is the best way to remain safe in this pandemic. And I will move towards what the CDC itself has put out. And this hasn't changed a whole lot from the start of the pandemic. We do understand that there is now greater understanding of how COVID spreads and how we can treat it and manage it. And so certain restrictions have been relaxed, but the pandemic is not over, and risks are still there. And there are groups that are at much higher risk than others. And a lot of people have heard about the reports of people who have certain medical conditions, including diabetes, obesity, hypertension, age being a factor, where the risk of getting severe illnesses or even possibly dying from COVID is higher, and even higher in patients who may be dealing with cancer or on certain types of medications that would suppress their immune response, chemotherapy being one of them, and other types of medications. And so these are the things that we believe people should be talking with their doctors about to get a much better sense of what is their risks are and what they really should do. But regardless of risk factors of pre-existing conditions, age, the number one recommendation is that everyone should get their COVID vaccinations and get boosted when eligible. It is now currently recommended for people 50 and older. There are certain groups who feel even when they are in the age group of 50 and older may not be at high risk and are choosing to not get the second booster yet. That is not something we will be discussing here today, but I do want to mention that you should be talking to your doctor specifically about this and checking to see if you are eligible, if you should, or if there's any reason why you shouldn't take it. But the point here is that the recommendations to remain safe in this pandemic is currently relying heavily upon vaccination, which includes boosting when eligible. So that's the first one we see here at the top right corner. And then other protection we have is still wearing a mask when indoors. Again, we believe that this can vary a little bit by community depending on the rate of infection that you have. And that's why everyone should really be checking with their local public health departments. The CDC
Dr.
also
Alabre?
has on their website a way for you to enter your county, of where you live, to see what your risks are and have somewhat of a tailored recommendation on protection. But
Dr. Alabre?
Yes.
Sorry, we can't see the slide that you're talking about with the CDC.
I'm sorry about that. Sorry, 1 second. Did you see the ones before that?
No, we're on the vaccine hesitancy bar graph.
Do you see the CDC slide now?
No, we can't.
Okay, sorry about that. Give me 1 second. I am.
Sorry to interrupt.
That is absolutely okay. We want the slide to show. I'm gonna try to share again. Can you see it now?
Do you want me to run it, Claude, and then I can run it for you?
Sure. Are you able to see it now? I'm sharing again.
No, we can't see it.
Okay. Yes, Efrén, if you don't mind trying, I can see if that
Sure.
works.
Yeah. Give me 1 quick second.
It's sorry, everyone. We were having a little technical difficulty, and
That's okay. Yeah, it happens. Zoom happens to all of us, so no worries. We're good. Just let me know which slide, Claude.
number 9.
Next one.
Oh, actually, if you don't mind going back
Want me to go up
this
there?
one,
Yeah.
because I was missing
Yep.
some of the legends in
Got
the
it.
previous slide. Thank you. So I hope we are back. And as I mentioned before, we have noticed a big difference in vaccination hesitancy among different racial groups that I wanted to sort of point out to everyone and see how we can help reduce this difference here and hopefully get everyone as safe as we possibly can. So the slide that I had referred to earlier that I was missing the age groups, the racial groups is now back, where we can see if we want to take a look. The first one here we have in darker blue is people who have said that they will definitely get the vaccine, and in Asians about 59%. In Blacks, it's about 46% of people who said they will definitely get it. And 40% had said during that survey in February of 2021 that they will probably get it, and about 11% said that they will probably not get the vaccine, and 4% said definitely not. And so when we compared that to our white counterparts, the population and there had 75% of people who responded to the survey had said that they will definitely get the vaccine, compared to, again, 46% in Black, 58% in Hispanics, 59% in Asians, and 44% in other races. And so this difference was somewhat concerning, because we, again, would like for everyone to be as safe as possible. And it's not clear what the reason was for, obviously, everyone who responded to this survey. We do have some understanding and some reports of what might have led to this disparity or trust in the vaccine. And so the way we have tried to address this is lots of different ways, basically, where there is a lot of community groups who have done conferences, talks, and question answers, and physicians who have reached out to their patients individually or on a clinic base, hospital base. So there's a lot of effort to really try to answer everyone's questions about what is making them hesitant about the vaccine. And obviously, we want everyone to be able to feel comfortable that they know what they're doing and why they should get this vaccine. And I really want to encourage everyone to reach out to their physicians, their community clinics, their hospitals, whatever it is that they have access to ask those questions that they may have about the vaccines, and hopefully be able to get the right understanding and the right information about its safety and proceed with the vaccine. As I was just saying earlier, that is still believed to be the best way to protect yourself and stay safe and prevent severe illnesses and possibly even death. And so I'm gonna quickly go back to this slide and talk about how the measures that one can take to remain safe in this pandemic haven't changed a whole lot. We certainly have relaxed some of them and tried to be a little bit more tailored so that people's risks are assessed separately and determine what you can do when it comes to masking, when it comes to staying distant, quarantining, and everything. But the main ideas are still the same. Try to do as much outdoor activities as you possibly can, and avoiding small crowded areas, indoor, poor ventilations as much as possible. And if you believe that you are at risk, especially if you have not had your vaccines, you should be masking if you are indoors or in places where you would be coming in close contact with people who might be carrying the vaccine, the virus, excuse me. And we know that there's been a little bit of a spike in cases recently, especially with the subvariant, that is again causing a lot of pause about the measures that we previously had, whether we should go back to those. I'm not saying we are, and I'm hoping in the questions later we can address some of these concerns a little bit better. But I wanted to also make sure that people know that they should be staying up to date with the recommendations that are coming out, that are changing based on the rates that we are seeing in the community. And so the next thing, this is, sorry, my slide changed. So basically, I will end here before my co-presenter takes over and say that staying safe is key. Going to your doctors are believed to be safe. Going to the hospital are believed to be safe. We don't want anyone to stop getting their routine care or their chronic care because of COVID, because it can be done safely. And let me turn this over now to Dr. Flores, who will speak with you a little bit more about safety and COVID, and then we'll take questions.
Okay, thank you, Claude, for the presentation. Apology for the technical difficulties here, but we're able to overcome here. And as always, Claude, difficult to follow Claude because he always provides an incredible wealth of information that is so relevant for everyone that is listening here today. So my name is I'm Dr. Efrén Flores. Work here at Mass General with my colleague Claude Alabre. I'm one of the radiologists here. I just want to say thank you to the Blum Center for having us today, and also for the MGH Equity Office, who we're part of the team, and for the opportunity to be here. So just to briefly shift gears, and I think Claude, I mentioned it in terms of where we are with the situation, what are the things that we can do, and how do we think about what we can do moving forward. And I have to say we're getting a lot of information from the CDC, from the news, and from the healthcare system. So, one of the things that we always say is to avoid, when you have any questions or concerns, or you need to clarify anything that related to COVID or your overall health, definitely rely on the people that you trust for your other parts of healthcare, right? So if you're trusting your doctor to give you advice about your preventative care services, your annual physical, you managing your diabetes, your blood pressure, those are the same people that can help you clarify some of the questions in terms of what is safe, how to best do it. But also, as Claude alluded to, the CDC has created a great resource, and learning from Claude that we're not fully aware of it, because the CDC have been tracking all the COVID cases, but at the same time have been creating a wealth of resources to guide us into different settings, to providing data that is specific to counties, and then making sure that the information is available for the general public. So we'll start, when we think about, move to the next slide. When we think about why it's important to stay safe and staying ahead of the COVID curve, we talk about, in this graph showing cases among COVID-19 weekly cases per 100,000 population by race and ethnicity in the United States. We can see different fluctuations or peaks and valleys depending on if it's Delta variant, Omicron variant, and where we are. And we can see that there are different peaks or waves that we've been discussing since the start of the pandemic. But if we follow the colors, which represent different race and ethnicity, we can see that Hispanic, Asian, and African American have stayed with levels that have been higher, particularly along the last peak. American Indian is another patient population that also, in Alaska Native as well, that have been staying high. So it just shows that the case among certain patient population or racial ethnic groups have been disproportionately impacted by the pandemic. So one of the things that we stress in our community outreach efforts is that it's important for each community to try to protect themselves, so we can not only protect yourself, but you're protecting others, your family, your community members, so we all stay safer together. And then when we think about the COVID-19, that's similarly since 2020 through 2022, we've seen different peaks and valleys or different waves in the death related to COVID-19. But again, our underrepresented minority community, including Black, African American, American Indian, or Native American communities, Hispanic, Latino, have disproportionately higher rates of death during the entire pandemic, particularly at those peak moments. And that just talks about the vulnerability that Claude mentioned earlier in terms of some of our community that have a higher risk, not only of being severely impacted with COVID, but also the impact doesn't limit themselves to the peak. It can also be long lasting. So one of the most important take home points from today's discussion is that as we are navigating the pandemic, we also have to make sure that our overall health is optimal. And the best way to do that is to taking control of your health and recapturing all your preventative health services like cancer screening, getting back, checking your cholesterol level, your diabetes, your blood pressure, you're making sure that you get all your vaccines on time as well, because that's the best way that you're gonna be, your body's gonna be ready in case that, we don't want it, but in case that you get infected, that you have your best overall health. But also, that's the way for us to build a better future together, because for us, the pandemic have clearly shown that we are all in it together. So this is not something that is affecting certain countries or certain towns. We're all being affected by the pandemic, some group more than others. Therefore, we have to work together so we can finally beat the pandemic. So recently, I was on a trip in Washington, D.C. over last summer, and we were visiting the Martin Luther King monument, and this is a photo of my kids in front of the monument. And the reason why I'm showing this is because, if you look at the side of it, when you think about there has a very important message that I not only relevant when Dr. King said it, but also applicable throughout and applicable during the pandemic, because, he said, out of the mountain of despair, a stone of hope. And I understand that for all of us, the pandemic have been very difficult. We've been away from our family. We are eager to go back to normal, and now it's a new normal, and what that new normal looks like. And then sometimes feel like there's a moving target. But what I understand is that the pandemic has also provided us an incredible opportunity to rethink how we deliver our care from the healthcare perspective, but also an incredible opportunity to partner with our patients, our communities, and our community organizations to improve the overall health and well-being of our communities. So we don't want to go back to care as usual. We want to have a new care delivery system. So when we think about what that looks like, and people talk about precision medicine, mean like the right medication or treatment for the right patient at the right time, particularly when we're targeting therapies for specific diseases, including cancer. And now we're moving to, the pandemic has shown that now we're moving towards precision public health, which is the right intervention on the right population at the right time. So it's important that we also, to achieve that goal of improving the overall health and well-being of our community, that we partner with our patients and their community organizations, so our patients don't get lost in between the healthcare setting and the public health sector. We're all working together to improve the future for everyone. And to what Claude mentioned earlier in terms of the COVID-19 CDC resources that are specific for county checks. So for example, MGH is at the Suffolk County level. So here you can enter the state where you are and a specific county where you're living, and it'll give you the level of COVID. This is like a weekly information that will tell you what level of COVID you have. And then it gives you specific advice based on that level. So the most important thing is that if you're at high risk of severe illness, talk to your healthcare provider. In this case, definitely feel free to talk to us. Make sure it's something that we advocate here, and what Dr. Alabre also mentioned, and we want to stress, stay up to date with your COVID-19 vaccine, but frankly, stay up to date with all your vaccines, because that will lead you to a better chance to take control of your overall health and live a better life and healthier. And then get tested if you have symptoms, right? So it's very important that if you feel that you're getting some symptoms, runny nose, a new cough, new sore throat, a new headache, and you're uncertain, we're lucky now that we have at-home testing, but also if you want to go to a clinic, there's definitely testing available in many places. So the importance of getting tested is so you can monitor yourself, but also the best way to protect your family and protect others, because then you can wear a mask, decrease the chances for others to get infected. And that's when we think about the importance of working together as a community, as a unity, as we are protecting each other and we're protecting ourselves. But also if you're infected with COVID and you're starting to develop more severe symptoms, then more important that you tell your doctor so everybody better informed and they can treat you. Or even if you're in a higher risk, they may start sending you treatments as well earlier. So the sooner with any disease, including COVID, early detection and early treatment are always our best tools to defeat any disease. And then when you look at and navigate this website from the CDC, and something that, again, that I give a lot of credit to Claude, because I knew some of the CDC website. I didn't know that I had so much additional information until he started saying, so that's why I give him a lot of credit for this. But you can see that this is a screenshot of the website that, depending on the setting, where it could be at work, in the school for your kids, they will give you specific recommendations that are applicable to your county. Why this is important? Because we know that COVID fluctuates, and those waves impact different areas. So for example, in Massachusetts, we may be low because we have high vaccination rates. We have been very good about infection control, but then some other states may not have the same level of vaccination rates, so the level will fluctuate, or they may have different recommendations for mask wearing depending on the setting. So the most important thing, and another take-home point from us today, is that we need to stay informed. Use the trusted resources that you have, where the CDC or your healthcare organization where you go to receive your routine care. Try to gather as much information from those trusted sources so you can make your best decision, because as we start seeing more people travel now, it's important that you know what are some of the recommendations or the risk when you're going to visit some family or friends in maybe a different state or a different county. And those things are very important to keep everyone safe and healthy. And with that, I just want to say thank you for the opportunity. We're happy to take any questions.
Thank you so much. We are now at the end of the session, so if you have any questions, feel free to enter them in the chat box. So we have a question about vaccines. What are we doing in the communities to encourage the importance of finishing up the vaccination, completing them, whether it be second dose, booster, second booster? What are we doing out in the communities?
I'll start. There's a lot of programs out there. I know different community organizations, different hospitals and clinics all have really put a lot of money and efforts to make sure people are getting the right information and having access to the vaccine. The state obviously has also had lots of different programs. Some of those have kind of dwindled out as the numbers dropped, but there's still a lot available. I do know a lot of churches for people who are part of those communities also will have different vaccination dates and times where they have to go out in the community to do that for access. Schools also have different vaccine campaigns that they will organize. Different towns will do this. And one of the biggest sort of vaccine administration organizations have really been local pharmacies. So CVS, Walgreens, these places, they have had a lot of vaccines available, and luckily they are in a lot of communities where people can have access to these. And so I believe they are now mostly requiring appointments, so you can go online and do that. But if you don't have access to internet or phones or whatever it is, you can always call or walk in. They will take your information. If they, for some reason, cannot give it to you at the time, you can always go back and do the vaccinations. Clinics obviously are equipped with that. I think part of the message we're really trying to get out today is that people should get in touch with their primary care doctors. If you haven't called in a couple of years, this is the time to do that. And a lot of clinics are equipped to do vaccines right on site at your doctor's office. So you don't even need to make an appointment or go for a second appointment. So do take advantage of that. And we do know that MGH has different education programs that they have set up where you can learn about the vaccine, ask questions if you have questions about it. And I'll name a few specifically. I have been involved with a program called Your Healthy Java, which is streamed on Facebook and Twitter every other Tuesday, basically the first and third Tuesdays of the month at 9 o'clock. There is also a program I can let Dr. Flores talk to a little bit more, but El Mundo and El Planeta, I believe, also have different programs. Things like what we're doing today on is also part of the education efforts to get the word out and answer people's questions. Lots of different hospitals and clinics will also put out different Q&A sessions. So do reach out. I know our viewers are probably mostly MGH and there's a lot available. We do send out messages every now and then on Patient Gateway, the portal that tells you about where you can get information, where you can access vaccines. Again, reach out as many times as you need to, because we really want people to know what they need to do for their health and to protect themselves and their families.
No, absolutely. I don't want to too much to that. I think that, what Claude mentioned is just, cover all of it. And to us, it's just very important just to ask the question, feel free. There is like a judgment-free zone, right? So there's no right or wrong answer. We're really here open to have an open dialogue, which I think is the most important part, because sometimes people may have hesitancy or concern about it. But when we have an open dialogue about to try to address those concerns, so many times we can resolve them and then get a vaccine, or sometimes, people need a little bit more time to digest that, and that's okay. Absolutely, we encourage everyone to get the vaccine. But but we also respect the patient's autonomy, so we want to make sure that we provide them with all the information that we can and make ourselves available at any moment, whether it's in the community or through social media or through a community event, at the hospital, at the clinic, anytime. We're always here. We're working healthcare 24/7 operations, so we're here for you. And the pandemic has shown something in that everyone in healthcare wants to do what is right for all of our patients, and we'll put everything on the line for it.
Thank you. Do you have any tips that you can share on talking about the vaccine with older adults who are more so hesitant than other populations?
Claude, you want to start with that one because you always have great anecdotes I was telling.
Sure, I'll give that a shot. Are we talking mostly about the boosters or the initial doses?
Could be either.
Okay. So, I mean, basically, in terms of the vaccine itself, we do really hope that most people by now have had the first initial doses. That is quite critical. And if you haven't, again, we've talked about if it's because of questions or concerns, this is always, I guess the time is always the right time to ask and get those questions answered and get started. Now, when it comes to the booster shot, the first booster, I know that's been a little bit confusing for some people in terms of how many of these do I need, and I've already had one booster. Do I need to have a second booster? So basically, going back to a little bit of the basics is that the way vaccines work is that we're training the body, in a sense, to know how to respond to the real deal if you were to get the actual vaccine virus. And so the body mounts a response where it makes antibodies, which I believe a lot of people are familiar with, which then can sort of neutralize the virus when it gets into your body. But the immune system can somewhat go dormant after a while, where it's not making the antibody anymore. Now, there are a couple of things that can happen. One is that it typically will go dormant, but if it's woken up by the virus, it's able to mount that response and make the antibody again, and you do okay. but the time of response can vary depending on age and medical conditions and new medications you may be on. So if you only got the first 2 vaccines, we don't have a great way to say right now how protected you are if you were to be exposed to the virus, because it varies for a lot of people. And so younger people, to sort of get to your questions a little bit before older people, for younger people, we expect that they are very likely to respond and mount that response. But for older patients, there is a potential that you don't respond in time, where the virus could actually start to cause you to be ill. You may even end up needing to be at the hospital before your body starts to make the antibody, because the virus can sometimes go really rapidly and it starts to spread and replicate before your body is able to catch up with it. And so that's part of the reasons why we really want people to be boosted so that they are ready to go the minute the virus enters their body, if they have an exposure. And I know Dr. Flores mentioned analogies. I do like analogies a lot. And the one I've been using mostly is that if you train a bunch of firefighters and they never get to see a fire, their skills are they're gonna get a little rusty. And so they may not be able to respond as quickly or as effectively to a fire if one were to happen. However, if you do drills every now and then, so you're keeping their skills sharp, they are more likely to respond quickly and effectively in the case of a real fire. So the same thing is sort of happening with the virus now. And for the second booster, part of it is because of, again, the surge that we're seeing with the subvariant. And so we don't know how sleepy people's immune systems may be now, or if they even have that training anymore, if they've forgotten about it, how to respond to the virus. So we want people to be able to be ready and get the booster so that we can either sharpen your body's skills to respond or start it over if it needed that kickstart again. And so it is important, and the higher your risk, the more important it is. It is difficult for anyone to assess every single individual separately and say, this is your risk, this is your risk. And so there's blanket statements from the CDC to just anyone 50 years or older should look into getting that second booster to be ready. But if you are concerned, then reach out to your physicians and sort of ask. They know you best, they know what your risks are, and can really make somewhat of a tailored recommendation if needed.
I love the analogy of the firefighters and the drill, but you see, I can't beat the story, the power of storytelling from Claude with that. The only thing I have to say, like, I wanted to add, because, you know, when we're thinking about discussing it with older adults, I can think of, you know, instead of the tale of two cities, the tale of two parents. So, you know, with my parents, I have my dad who like do anything in terms of healthcare, like he'll follow everything to the line to stay healthy. And then my mom will always have her doubts. And so the conversation, because the other day we were talking about the booster, and then my dad said, sure, I'll just get it. And then my mom was like, well, why do I need another one? And so we always talk about the importance of your preventative health to have better overall health. But before, it was a similar conversation about getting the annual flu shot. And again, we still need it, because our role is always for advocating for vaccine, because we want to prevent any serious event, right? So you may still get the disease, in this case COVID, but it could be flu, but you want to decrease the chances that you get a severe infection. And that's always the conversation around it, just to, if you want to have the best chance, because the main issue with COVID is that we hear a lot of stories, right? Some people say, I got COVID, it was nothing. Like, I had a nephew that got COVID, and the only thing, he had maybe a little bit of a fever. One of them didn't even have, he had no symptoms. He just had found that incidentally. And then the other one got, you know, some pretty bad GI symptoms. And so it varies. And then some people, and we hear a story about people ending in the hospital, and unfortunately dying as well. So if we want to narrow that variability in the outcomes that can be related to COVID, the best way for us to do that, and the best chance that we have, is to getting vaccinated, right? So when you can do something in a safer way, why not, right? So I wouldn't ride my bicycle without a helmet. I could, but I wouldn't because that's safer. I'll drive my car. I could drive a car without a safety belt, but we know that seat belts save lives, right? So it's a safer way of doing it. Same thing for COVID. You can live your life in a safer way if you get vaccinated. And that's the message that we want to deliver here today.
Thank you. Do you have any tips on traveling safely, particularly those with young children who can't get vaccinated yet?
I'll start again. That is a very interesting question, and it's a hot topic these days, especially with the changes in recommendations for airline travels, where it's no longer mandatory to wear a mask. And so I know that's caused a lot of anxiety and concerns for people who have younger kids who are not vaccinated, as you mentioned, and also people who are at higher risk, people who may have cancers and other things like that. And so currently, we do know the CDC's position on the masking for airplanes. They do believe it's still necessary and needed and should be done. So we don't want to get into the politics and other things that sort of could cloud this recommendations, but the scientific recommendation is that it is still necessary and would like to see everyone still continue to do that. And now the question is, can someone choose to do it by themselves? And how effective is it for one person to do it and no one else is doing it? And so that's a little bit complex as well, because the level of protection that you have does vary based on the type of mask that you wear. We do know that certain masks are better at protecting you against people around you than others. And so some of the teaching when the pandemic first started, and I believe a lot of people are familiar with, is that your mask is mostly protecting you from spreading it to other people, not so much protecting you from getting it from other people. That is true to some degree. Nothing is 100%. So wearing a cloth mask, say, for example, does reduce your risk of getting COVID from someone else. Not a great degree of that. If you go to a surgical mask, you get even higher protection from getting it from other people. And if you go to an N95 or KN94, there's a few other types out there. So the protection goes up. And so currently the highest level of protection we know there is from a mask is the N95, which is unfortunately not always accessible. There is a lot of different versions out there. Ideally, an N95 should be worn if you've been fitted for it, where we know the exact size and fit for your body. That's not feasible to do it for every single person. So the commercial versions that are available right now in stores are not as great, but pretty close to what the fitted ones would be. And so if you have the ability to, and you are concerned, especially if you're high risk or if you have children who are not vaccinated, if you can, this would be the recommendation, especially for flying or even on buses or trains where there can be close contact with other people. And so that's sort of the general recommendation that has remained the same from a scientific standpoint. And then when it gets to the people who are vaccinated and young and no medical conditions, you can sort of think about how much risk are you willing to take and make that decision for yourself.
I would say, Claude, I don't have much to add except wear a mask. I recently came, I was in for a conference in Washington, D.C., and it was interesting. I was there a couple of weeks ago before the changes in the CDC recommendation, right? So everybody wearing masks right from the airport and inside the airplane. And then yesterday, when I was returning, even though traveling on the weekend and yesterday returning, just different. The compliance is different. I was lucky to be sitting next to somebody that was wearing a mask, and I was wearing a heavy mask just to make sure that I get, we all get protected. But it's just that's the situation that we're going to be navigating. So I understand that the concern, and it's something that we encourage, to talk with your doctors and your trusted providers to see what's the safest way to keep everybody healthy.
I just want to quickly add that the mask recommendation has not changed in hospitals and clinics. And so as we've been talking about getting back to care and going to see your doctors for your routine and chronic illness and not be so worried, this is not one of those situations. Luckily, so far, everyone in clinics and hospitals and MGs are still wearing masks. So you don't have to worry about coming into our waiting rooms and possibly getting people who don't wear masks. That's not the case.
Thank you. Before we end today's session, do you have any final thoughts you'd like to share with the audience?
So my final thoughts are, again, reiterating, I think, what I started out with is that stay up to date, follow the recommendations. The pandemic is not over. A lot of things are better, including treatment. And that also includes the new pill that we have, and infusions and whatnot. And so a lot of things are better. It's not done. And we really want everyone to stay in touch with their physicians. If you, for some reason, do not have a primary care doctor yet, you should get one. If you do, you should feel really comfortable, confident to continue your routine care and your chronic care. And when questions come up, reach out and see what is best for you.
And I would like to add to everyone that is listening today that it's important that not only to take care of and take control of your health during COVID, but also use this opportunity to recapture all your routine care. So don't delay your cancer screening tests, don't delay your blood pressure monitoring, your diabetes, your any other medication, or just make sure that your conditions and all your prescription and you're seeing your provider as much as possible, because I understand that everybody very busy, and I understand there's a lot of things happening and a lot of uncertainty that we all are navigating, but it's crucial that as part of that, we start incorporating and going back to your routine care so we don't get any surprises, because with anything, whether it could be with COVID, with diabetes, blood pressure, with cancer, with anything, the best treatment is early detection and early treatment. That's gonna be your best outcomes for anything. So with that, I just want to say thank you for having us today, and any questions, please feel free to reach out to us at any time.
Thank you so much for a wonderful presentation. And thank you so much, everyone, for joining us today. As I had mentioned, today's session is being recorded. So if you're interested in being the recording, it'll be made available on the Blum Center website at massgeneral.org/Blum-Center. Thank you so much, everyone. Have a lovely rest of the day.
I thank you.